my mighty shifters. Thank you so much for joining me today. I am Corrina Jackson. This is Shift Happens. I am your bougie boss lady, your morning snack, your noonday nibble, and your evening unwind. And around here, it's about real talk and real impact. But before I go any further, I'm going to ask for you to like, subscribe, and share. People sometimes think shift happens is only about maternal and child health. Remember in my first episode, I talked about why I founded Supporting Healthy Initiatives for Tulsa. So that was about why I founded a nonprofit. This is why I decided that Shift Happens, this podcast, was necessary. And listen, maternal and child health will always be my heart. Babies, mothers, families, that's where my journey started. That's where the fire was lit. But let me be clear. Shift Happens is about so much more. Shift Happens is about healthy initiatives across the whole community. It's about every piece of our lives that affect our well-being, our mind, body, and spirit. Because the truth is, health isn't just about what happens in a doctor's office. No. Health happens in our homes, in our jobs, in our schools, and in our neighborhoods. Health happens when we're brave enough to ask for help. When we learn how to take care of ourselves, even when the world tries to wear us down. Shift Happens is here for all of that. So we're going to be talking about all of those wonderful things during this podcast time. And I can't wait for you to hear some of the wonderful things that I have in store for you and some of the wonderful people that I'll be talking to, some of the experts, some of the families that we've impacted. I'm just so excited about it. But let's talk about self-care for a moment because that's a word we love to throw around. And we throw it around like it's a spa day. But real self-care is gritty. It's choosing to rest when your body is screaming for sleep. Something I go through daily. It's going to therapy even when you're scared of what might come out of it. And let me say, therapy doesn't only have to be you talking to a psychologist or a psychiatrist. Therapy could be you talking to a friend, a family member, someone that is willing to listen without judging you, someone that will give you honest feedback. That's kind of what therapy is. Therapy can also be meditation. I had a friend who called me who was like, I know nothing about anything but meditation. And I was like, that's deep. That's deep. I mean, a lot of us need to learn about what it takes to calm our bodies down, to really get the necessary rest that we need, the necessary openness that we need for our bodies to really just be at peace. And sometimes it's about letting go of guilt and giving yourself permission to simply be. And it's not pretending that it's easy. Let's say that we can't pretend that it's always easy, especially when life keeps throwing curveballs, when money is tight, and when you're the one that everyone depends on. And listen, I go through that myself. I mean, my mom passed away a year ago, and I didn't realize how much I depended on her. She's the matriarch of my family. She did a lot for my grandbabies when school time was in. We're in our summers right now. She was there, and you really don't miss a person until they're gone. And I really didn't realize how much a 75-year-old woman impacted our lives. I mean, she worked every day as well. She was basically the breadwinner of her family because my stepfather had retired. And so I just, she was my everything. And I found myself needing therapy after she passed away. And it wasn't like your basic, go in house type therapy, because I'm not making light of that. I think that is so unnecessary. It was actually talking to friends about and crying. Listen, I cried on the shoulders, on the phone of many of my friends about my mom passing away. And so that was therapy for me. It got me back on my feet. It got me thinking about, what do we need to put in place? But that was a trying time in my life. And so I'm not making light of it, or I'm not pretending that, therapy is not needed, or the type of therapy that you may need. Depression. Let's talk about depression. I mean, I went through depression with her passing away. That's when anxiety creeped up. And I thought I was a person that really had it all together. But then that's when you really realize, when things happen like that you really don't have it all together. You really, really need a shoulder to lean on. My best friend was my shoulder to lean on. She was there for me. We've been friends since 13 and 12. So I'm going to tell my age. I say I never tell her age. But, I'm 58. So you can just imagine how long that we've been friends. But she was there for me to cry, to lean on. And then there's other friends that I cried because I just couldn't control it. I needed someone that I could talk to. And these, depression and anxiety, these are real, real true battles. And they don't care if you're a CEO like I am. That brings on more stress. I've got to make sure that there's jobs in place. My staff, right now, one of our programs funding is under attack. It's federal funds, and it's under attack right now with everything that's going on in our new president's administration. We don't know what that's going to look like. We don't even know if we're going to be funded. If we don't receive funding, that's going to probably take my whole organization down. So those kind of things bring on depression, and I try to snap myself out of it before I just really start slipping into it. And so, like I said, it doesn't care if you're a CEO or if you're working 3 jobs to keep the lights on. And let me say that I've met mothers who smile in public but cry in silence. I used to be one of them. Fathers who walk around looking strong, but they feel like they're drowning. And teens, oh my God. Let me say, teens who carry weight on their shoulders that no teenager should ever have to carry. And this past couple of summers, I've witnessed some teens to take their own lives. And I have a 13-year-old grandbaby, and I couldn't fathom her taking her own life because of something that could have been resolved by maybe talking it through or something like that. So I'm always open to hear what kind of problems that she may be experiencing or going through. She's a little person like I am. So therefore I know that there be times when kids may not understand that. They may not even want to be around her, and bullying. It's real, y'all. And cyberspace bullying is even bigger than just bullying in person. So I try to make sure that I'm there for her at all times when she wants to talk about things that are bothering her. I think it's important that happens. And that's why shift happens. That's why this podcast exists. Because we're going to be talking about those hard, difficult conversations. And you want to be in tune for it. You want to be here for that. I think everybody needs to hear it so that we can talk about these things. And so we can name them. Because once we give them a name, we can fight them. Shift Happens is all about shining a light on these incredible organizations in our community. Because it's so easy to talk about the bad things that are happening in your community, but I think it's important for us to hear about the wonderful, good things that are happening in communities. And not just Tulsa, Oklahoma, from where I'm from. I'm going to be talking to various communities across the United States because I have friends across the United States. I belong to a program that has 115 projects across the United States. So to hear from some of those project directors and hear some of the impact that they're making is going to be remarkable for us to hear. So I'm going to make sure that that happens. I want you to be in tune for that. And like I said, there's people doing good things in the type of work that we do and just different type of work every single day. And there's community centers that offer mental health support. We need to hear about that. Nonprofits running programs for fathers. They are left out so many times. and group helping people start businesses. I'm a business major. And although I tried to get into all the way embedded in social work, it always kept pushing me to the business part of things. And now, like I said, I'm the founder and the CEO of a nonprofit. But I do a lot of my work on the business side of that nonprofit. And then churches teaching financial literacy, and not just churches teaching financial literacy. We're going to be talking to programs that are out there that teach financial literacy, organizations that teach financial literacy. I think that's so important, especially in these days and times. I think that people need to learn how to save. Babies need an opportunity to go to college, and so their parents need to learn how to save. Even with parents who think, I don't make a lot of money, $5 goes a long ways if you could save that $5 each month. And at the end of the month, and you have a lot of money to invest and save on. So we'll be talking about that. There are so many heroes out there too, and you deserve to know about them, my mighty shifters. I'm not going to leave you out. You deserve to hear. Because sometimes the help we need is right next door. And speaking of community heroes, let me talk about something that's close and dear to my heart, and that is health literacy. So many times you hear about people going to the doctor. I've met so many clients who didn't know that they could ask their doctor questions, who were terrified of sounding stupid, who left appointments more confused than when they went in. And it don't even have to be just about clients. I have my own personal stories about that as well, of going in, talking to a provider who, may have turned to the nurse and said something that I did not understand. Thank God I had the confidence to say, listen, what are you talking about? Because I don't understand what you just said. But there's a lot of people out there that don't have that confidence. We are going to be listening to their stories because it's not their fault. I mean, our healthcare system is complicated. Let's just face it. It's filled with big words, rushed appointments, and paperwork so thick you think it was a college textbook. But Shift Happens is here to say you have the right to understand your health. You deserve to ask your provider every single question you have until you get an answer that you understand. And fathers, let me talk to you for a second because I see you. I see you. I know some of you stay quiet in doctor's offices because you're afraid of your questions that might lead to conversations about child support, afraid someone's going to judge you. But I want you to know that you have the right place here to ask your questions and the right place to sit and listen and maybe not ask questions, but think on things and maybe offer a comment. We're here for you. You have the right to ask questions about your child's health and your partner's health and your own health. When I started in this business of maternal child health, I think 10 years after I started the business, I had an opportunity to work at the health department. And one of the things I wanted to do was start a father-friendly program. And that was for fathers to be able to go into those doctor's offices and me work with those providers in those doctor's offices to make them father-friendly. Even if it was just to put a Sports Illustrated magazine in the office. And to get those providers to not just talk to the moms, because sometimes they look at the moms and they don't look at the dads, but to talk to them as a family as a whole, because it takes two to tangle. And that was something that I had to kind of get that across. But I just want to let those fathers know that, Shift Happens is here for you too. And let's talk about dreams. Shift Happens is about clients who want more out of life. I've met mothers who want to go back to school and fathers who want to open up a business, teens who want to become doctors, teachers, and artists. And they should, because our community doesn't just need to survive, it needs to thrive. So I want a little bit of everybody here. I want a little bit of everybody listening to these wonderful podcasts that I've taken the time to, think out. And I've thought it out. And I know that I want this to be something that benefits everybody. So let me just share some hard truths. And let's go back to infant mortality for just a bit. Oklahoma still has some of the highest rates of infant mortality in the country. in the country. And black babies die at more than twice the rate of white babies. Let me say that again. Black babies die at more than twice the rate of white babies. These are not just numbers. These are families. They're our future. They're our generations. And that's why maternal and child health will always be a piece of Shift Happens. But the fight is bigger than that. It's bigger than that, y'all. The fight is about healthy food on the table, safe housing, quality education, fair wages, affordable mental health care. It's all about the things that make our community strong. Shift Happiness is about connecting you to resources. It's about shining a light on organizations doing good work. It's about giving you the tools and the courage to ask questions, seek help, and take the next step. I believe something with my whole heart. Change does not start in big government buildings. Change starts in living rooms, in barbershops, in church basements, in podcasts like this one. Shift Happens is here to remind you that even when life feels impossible, you are not alone. So whether you're struggling with depression, trying to start a business, looking for resources in your neighborhood, or just trying to understand the words on a doctor's report, Shift Happens is your space. It's real talk, real impact, and together we are shifting community atmosphere and involvement one step at a time. I would like to refer to Shift as the meat of the matter, and I'll be serving it up slice by slice, plate by plate, because I think that you need to know. I think it's important. But once again, I like to say that I'm so glad that you tuned in today. I'm Corrina Jackson. I'm your bougie, confident boss lady. I'm your morning snack. I am your midday and noonday nibble. I am your evening unwind. And we'll keep talking and we'll keep shifting. Until next time, I am Corrina Jackson. Take care of yourself and take care of each other. Bye for now.